All right, Medicare 2022 by Exertus, hosted by yours truly, Ho Tran. So those of you excited joining or learning about Medicare, it's very exciting because it's an extra tool that we can use to assist our clientele. And if you're especially good in Medicare, well, that's a good lead-in, right? You do the Medicare, they turn 65, they just retired, they lost their health insurance. You help them with the Medicare. What else do they lose when they leave the job, right? The life insurance. And then, what else they can do, right? Their 401k, now you can give them lifetime income with Infinity X, right? With annuities. That's how you become a true professional. I like to call it the triple X factor. Medicare, life, and annuities. Take care of them while they're still healthy. We take care of their family when they're gone. And we take care of them to make sure that they not have any money or winding up going back to Walmart, Target, Costco, whatever, to do 4 hours a week, 8 hours a week, just to meet ends meet, right? Take care of them for income for life, right? So you want to be a true triple threat in the financial industry, and this is how you do it by starting with the Medicare help. So what's Medicare? Well, there's 4 components. We'll talk about the first 2, Part A and Part B. That's original Medicare. Okay, here in the middle, that's the Medicare ID number. That's the name. Part A and Part B usually is when they get it, 95% of the time is when they turn 65, and that's the birth month. Okay, so he turned his 65 in March 1 all the way up to March 31st. His coverage began on March 1st. Even though his birthday is on March 31st, he gets it activated as long as he turned all the paperwork. So yeah, most of the time it'll be March, both for Part A and Part B. So what's Part A? Part A is hospital, right? Hospital benefits. Monthly premium is typically $0 a month. Certain conditions must be met to receive these benefits, right? But generally speaking, it covers inpatient hospital care, skilled nursing home. That's not custodial or long-term care. That's a different type of coverage. Okay, home health care and hospice care. Right. So the breakdown. First 60 days, those are the copays. Then the 61st day to 90th day, that's per day, $194. In 2021 is $371 a day. And then lifetime reserve co-insurance, and then if they're in skilled nursing facility, it's at $185.50 per day, up to $14,840. Right. So what does that mean on the bottom? Was the out of pocket up to 5 times for inpatient hospital? That means you go to the hospital 5 times. Doesn't matter if it takes 2 days in the hospital or 60 days in the hospital, right? It's gonna cost you $14.84 each and every single time. Example A. John broke his hip, boom, 40 days in the hospital. It's one-time fee for just the hospital, $14.84. Next time he sprained his ankle, 2 days in the hospital, he still has to pay $14.84. He has to do this 5 times, and on the 6th time, he doesn't have to pay the $14.84 for the first 60 days. How does it work from 61 to 90 days? He has to pay 371 days every single day from 60 plus until he reaches 11,130. As soon as he reaches 11,130, he doesn't have to pay 371 days for the 61st day and on. So example, he went to the hospital twice. First time, 9 days in the hospital, he pays $14.84 for benefit period from day 1 to 60, and then day 61 to 9, he paid a total of $11,130. Second time he went to the hospital, he went for 65 days, $14.84 for the first 60 days. He pays nothing for the next 5 days because he already hit that cap of $11,130. Okay. Scenario number 2, he went to the hospital 65 days both days. He'll pay the same amount for both visits because he hasn't reached that 11,130. He will still have to pay the 371 until the 61st day to 90th day bracket reaches a total of 11,130. Okay. Now he goes to the hospital 6 times, right? Third example, go to the hospital 6 times, first 5 times 60 days, right? And the 6th time is 90 days, right? So the first 5 times he has to pay the $1,484 each and every single time. On that 6th time, he doesn't have to pay the $1,484 because that's his 6th time in the hospital. But on the 6th time, he spent an extra 30 days. But that's his first time spending 30 days. He has to pay $11,130. Medicare Part B, that's medical, right? So first is hospital, second is medical. You want to think of like staying at a hotel, right? Part A is the stay. This is what happens when you stay. Part B is the service. If you want, room service, dinner, open bar, whatever it may be. That's what Part B is. Part B insurance is $148.50 in 2022. We need to update the slide. It's $170.10 for 2022. $170.10.
Wow, that went up that high?
Only $20.
I mean, yeah, but okay. Does it every year go up?
No, it depends. So you go back to this list. You see how 1966 to 1968 it's only $40.
Yeah.
So those 2 years stay the same, and then gradually it went up, right?
Yeah.
And then look at 2021, it went up double, right, in 20 years.
Yeah.
So it just depends. The good news is that in 2022 benefit increased, but when benefits increase, Medicare charge more.
Yeah. Okay.
All right, so it covers everything else, but this is deductible of $230, I believe. Correct. I might be wrong there, but after the deductible, it's 80/20. And unfortunately, these are people who are on fixed income, right? So if it's $100,000 bill, they have to pay 20% of it. If it's $200,000 bill, they have to pay $40,000. Okay. So in 2022, 20% of the approved amount. Okay. 203, and then 20% of the approved amount. So that's a challenge there, right? So what we do is we able to help cover these seniors with Medicare Advantage to help with that 20% co-insurance. How do we do that? Well, what's the coverage is best for you? There's 2 options. Option 1 is have A and B. Get a Medigap, that's a Medicare supplement insurance policy, right? And get Part D. Or option 2 is get Medicare Advantage. Medicare Advantage is A, B together equals C, and it includes D as well. So it's all in one plan. Okay. So this is what it looks like. Everybody has A and B. Does that make sense?
Mm-hmm.
You have to have A and B. You don't have A and B, you can't have anything else. Okay. So you get A and B, and then you have the option to do Plan F, Plan G, Plan K, LLM, and then you add Plan D. Okay. So a lot of people will do Plan N and Plan D together. But why not get Plan C? Look at Plan C. It covers everything. Except for the Part B, which is the $170.10. Because C will include D. Right? And look how much it costs. Well, Plan D, lower drug costs, potential against higher cost of drugs, possible Part D penalty and prescription comparison. So that's why Medicare Advantage is the best. It's one plan, one card. A, B, D equals C. When can you get Medicare Advantage? There's AEP, that's the annual election period, from October 15th to December 7th. You can get any plan, no rules. SCP, that special election period, that means you have to fall in these categories to be able to change your plan. Either low income, subsidy, change your residence, loss of employer, loss of medical coverage, losing LIS status, or state senior RX program. There's also OEP, open enrollment period, from January 1st to March Oh, January 1st to April 1st, right? March 31st. From January 1st to March 31st, you can change from plan to plan. If you don't have a Medicare Part C, D plan, a Medicare Advantage prescription drug plan, you cannot use this to get a new plan. You have to have an existing plan to change plans. And there's IEP. That's the initial election period. You're turning 65, not 64. So when you're turning 65, there's the 3 months before and after grace period where you can enroll. So for example, let's say your birthday's in April, you can enroll in January 1st. It's not effective until April 1st.
If your birthday's in February?
January, December, November. So you can enroll in November, but it's not effective to February.
How about if they miss the 3 months?
Before, you start 3 months after. You're just not covered until you enroll.
Okay, so you enroll and it takes 3 months to...
No.
Oh.
You get 3 months ahead of time. So for example, let's say your birthday is in April, right?
Yeah.
And it's April, May, and we're in June. You have this month and July to enroll. But if you enroll in July, it's not effective until August 1st.
Oh, okay. So the February birthday, because they missed the 3 months, they can enroll now and it won't kick in till...
They can go now, it won't kick in till March.
Till March, got it.
Right.
Makes sense. I got it now.
Yeah.
Thank you.
So whenever you enroll, it's effective the following month. But if it's only for people 65.
Oh, okay.
Yeah, that's called IEP, initial enrollment period. They can do 3 months before and 3 months after. And the reason why they give you those 3 months, because what if you're working, right? And then you're not off until after you turn 65, they give you those 3 months to do it. But ideally, if you know that you're getting off, you need a letter from the employer, and that way you can do it. So that way you're not missing coverage. Because the last thing you want is you don't have coverage from work because you're retired, and then you're not covered at all. So you're sick and you don't want to go to the hospital, but you have to. But you have to wait 2 weeks because your policy is not effective till the following month.
Yeah, gotcha.
So you want to make sure that you can enroll while you still have coverage. You just gotta make sure that the effective date lines up at the right time.
Oh, got it.
Okay.
Cool.
So why Medicare Advantage? So let's do a real life comparison. So that way you see how important it is. Because if you don't have C and D, remember you have to pay 20%, right? So depending on what county, and every county is gonna be different. So this is your county. Who wants to volunteer? What county?
Pierce County?
Sure. What zip code?
98371.
Pierce County. In Pierce County, there are a total of 45 plans. We only focus on Medicare Advantage prescription drug 23. Right? These are for people who are in military. That's why I say Eagle, Honor,
Okay.
Patriot, right?
What's the keyword for the military? It's Medicare, like how?
It has something to do with military. Eagle, Honor.
Oh, okay.
Right?
Oh, got it.
But it's the middle. Okay. This one's prescription drug only.
Got it. That's for everybody.
It never makes sense to do this because Medicare Advantage prescription drug, you see how much prescription drug costs by itself? Right? But if you do Medicare Advantage prescription drug, it's included and it's free.
Nice. Yeah.
Right? And then Medicare supplement is for people who make like a good amount in retirement. So you design the plan for them.
Got it.
So Medicare Advantage prescription drug. So the way to find a plan for the individual, right? Some of them will cost money, right? But the way you find the plan for the individual is, a couple of things. Number one, do they like the doctor? If they want to keep the doctor, then you put in the doctor's information. Sometimes they like the doctor because of the language barrier or just familiarity, right? So you do Martinez. Boom. Search. Boom. Here's all the Martinez's.
Okay.
I want a internal medicine. Yeah, I want Catherine Martin. Right, now Martinez. Jaime. Okay, Bullet. And then you list all the prescriptions. Because if the prescription is not valid, then you'll know. So, for
Okay.
example, let's do Wellbutrin. See, bupropion is the generic, right? But what happened when I'm do the generic? And Prolia. So these are two brand names. Then we do Simvastatin. And we can go to plans. Most pharmacy will take it. It would be foolish for pharmacies not to take it.
Mhm.
Boom. Okay. Jamie is not a provider. Jamie's not a provider. Nope. So Jamie doesn't take Medicare clients.
Okay.
So
Because so it shows where?
right there, say X. Boom, boom.
Oh, okay. So if it has X, it's not. He's not taking those medication.
No, he's not taking Medicare clients.
Medicare. Okay.
Right. Janice Austin, let's see she is. I probably should click selected a couple.
So we just go on until we find someone who
Yeah.
accepts.
And then the medication they take it, right? Proer, but not the Wellbutrin, right? So click plan details, and you see how much it costs them? Almost $6,000 worth of drugs. Right?
Yeah.
That's a lot. See, nothing. 65 cents for Simvastatin, $0. Right? But look at Proer, cost them 70, 47, and it's not covered. Wellbutrin is not covered, right? So what do? We asked the senior, hey, do you want to take the generic?
Mhm.
What's a generic? Well, have you been to Sam's Club or Walmart and you buy the Sam's Club Coke or Walmart Coke? They say, yeah. Well, that's what that is.
Mhm.
And they say, okay,
The
well,
brand.
it's not a big deal. But yes, I want the bupropion. So you take that out, and Proer is albuterol. Okay. Now they're all generic. Boom. Cost $0. See that?
Mhm.
Boom. Drug cost $0. This one costs more, right? Because every plan could be different, right? It depends on each plan how they negotiate pricing with the drug company, right?
Uh-huh.
So that's why it matters. You have to put in the drug, right? Simvastatin, this one costs them $1.50, so they charge you $1.50. Here's 27, $13, right? So they're not getting very good prices, but it's a PPO. You can choose any doctor you want,
Okay.
right? Versus HMO POS, that's the second best thing, right? Because they can choose any doctor they want to,
Okay.
right?
So what we did was looked for prescription and to see what doctor accepts it, and then we compare how much the price is.
Right, because usually that's the thing that seniors care about. I want my doctor and I want my drugs to be taken care of.
Yeah.
Here, drugs are taken care of.
Yeah.
$0 before the gap,
Yeah.
right? Even if they have to pay retail, 65 cents.
5 cents. Yeah.
No. So in this member situation, if they don't care what doctor, I would just go ARP, Medicare Advantage, Walgreens, right? They don't have to get at Walgreens. That's what the plans call.
Okay.
Okay.
Oh, got it. Okay.
And then you just look at the special features, plan details, and then each plan will, most of the plans, it's the same, similar, right? They're gonna have dental, right? So click dental, search for dental, right? They're gonna have dental. They're gonna have vision, right? Or you can just scroll down, summary of benefits, and do it that way, right? Dental, right? Vision, right? $100 every 2 years.
Mhm.
Now everything's gonna be different. One company might give you more money, one whatever, right? It just depends. So this one, fitness program, Renew Active. If you don't know what it is, it's usually Renew Active or uh so Renew Active is there. Find a fitness location, right? What's the zip code again?
98371.
Boom. They can go to any of this gym for free.
Nice.
Planet Fitness, UFC Gym,
It'd be nice to be a
Pure
C.
Barrier, Anytime Fitness, right? YMCA, that's usually the premium, so they can
Mhm.
get that for free,
Yeah.
right? Some of the companies they use silver sneakers, same thing. Fitness location search,
Online.
right? And then what's the zip code again?
98371.
So boom. Again, Planet Fitness, UFC, right?
Oh, okay.
There's a senior program within the gym, but
Yeah.
because they have that silver sneakers, they can have access to the gym.
Oh, got it.
Cool. So
Silver.
anybody with any questions, you like what you see, make sure you hit that like button, smash
Subscribe.
that notification bell, and obviously subscribe. That way you get more information, not just on Exertus, but 720 Capital Group. I'll talk to you guys then. Have fun.